Namaskar. We would like to welcome you all on our 472nd milestone of the journey of AYUSH SAMRIDDHI International Webinar Series. The brainstorming, educational, inspiring, motivational, really a journey beyond expectations. A platform, international branded platform has been created. We started this journey to negate the negativity of pandemic, but this continuous flow of knowledge river clan Ganga, AYUSH Samriddhi is enriched by you, all the speakers, all the audiences, all the experts, near about 2000 plus experts of various faculties from AYUSH as well as homeopathy, allopathy, every faculty of health sciences have blessed this platform, and guardians like V.K. Agnihotri sir, Madam Parul ji are really blessing this platform regularly. We are proud of them, and they are pillar of AYUSH Samriddhi, blessing this platform again and again. Team AYUSH Samriddhi, Dr. Devnath, Dr. Parikshit Devnath from Calcutta, and Dr. Momita Sharma from Calcutta are supporting to continue this journey. So we are here today to celebrate the Menopause Day. We started this journey with the lifestyle disorder, and then we started celebration of every day in relation to our AYUSH. Dr. Jamal Muhammad Nasir, I welcome you. I don't know you are from Unani or Ayurveda, but if you are from Unani, please support us by inviting Unani experts also. Respected Vishnu Prasad Sharma ji, President, Vishwa Ayurveda Parishad, Assam, ex-principal, Government Ayurvedic College, Guwahati, member NSISM, is our guardian of the platform. He is just live from the Assam. Thank you very much for the joining, sir. Without wasting much time, Namaskar sir, Swagatam. Without wasting much time, I would like to request you for your initial blessings.
Okay, welcome. Thank you. Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri ji, respected Dr. Pawan Kumar Sharma ji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on menopausal syndrome, Ayurvedic care. It is the most important subject. Today we have eminent speaker, Dr. Divya P.S., Assistant Professor, Department of Anagha Tantra, Ayurvedic College, Coimbatore. I welcome you, Dr. Divya P.S. Next, I want to welcome Dr. Anjaly M.B., Assistant Professor, Department of Prostheti Tantra and Stri Roga. Next, I want to welcome Dr. Anagha Sivanandan, Assistant Professor, Department of PTCR, Jamnagar. Next, I want to welcome Parul Joshi, Principal, Sri Bala Hanuman Ayurveda Mahavidyalaya, Gandhinagar. I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on menopausal syndrome, Ayurvedic care. Once again, I welcome all of you. Thank you. Namaskar. Over to Pawanji.
So nice of you, sir. Thank you. Thank you very much for your blessings. Now I would like to request Professor V.K. Agnihotri If he has not entered into the event, welcome, sir. Wow.
Thank you, sir.
Are you in a...
Thank you, Dr. Professor Pawan Sharma ji. It's my great pleasure that we are celebrating our 472nd webinar in the same continuation. As I informed you that we are here in the Dole Patel Institute of Engineering College and Physiotherapy Center. So we are celebrating the Diwali Yatra. It's a great festival after Ganapati. So I welcome all the guest speakers. I am very much interested to listen to them. But fortunately, I am here because of some my students. And moreover, as we all know, that health is very important for everyone. And when it comes a matter of females, it becomes much more important because it is the females with the grace of them we are. So if the females will be our 50% population will be okay, then only we will be having enjoying our health. So today's topic was among the menstrual disorders and menstrual say health. It is very important. And today evening we are going to listen very good information from our distinguished guest. As we all know that Dr. Parul is always completely perfectly a great orator on this subject. So we try to listen them, and I welcome all them to come with their knowledge and make our webinar much more informations, as she is always putting forward so many her own experiences, patient experiences. So with these words, I welcome all, and I wish that this webinar is going to be a great success. Thank you so much. Over to Pawan Sharma ji.
Thank you, sir. Thank you very much, sir. Thank you very much. I salute your gene to be united. Now I would like to request Dr. Divya. Dr. Divya PS. Welcome, Dr. Divya. Again, I am requesting you all. This will be live on YouTube and recorded on YouTube. So please circulate it amongst students circle, because this platform is absolutely non-commercial with a holy aim, infinite series of numbers. We have forgotten the counting of number of webinars. So thank you very much. Divya.
Yes, sir. Thank you. Thank you so much.
God bless you. Welcome.
Yes. Namaste, one and all. Om Shri Gurubhyo Namaha. It gives me immense pleasure to be in this platform, as we all as the explorers are explaining the Ayurveda, to take the Ayurveda all worldwide. It becomes a blessing from the Guru Dhanvantari and all my almighties to be here in this platform to speak little bit about the Ayurveda related things. And I really telling my words of respect to all the dignitaries here and all those who are giving a opportunity for this organizing and conducting such a beautiful, wonderful days of combined work of seminars. Thank you, everyone. And let me start my talk today with a small prayer. Om. Shri Gurubhyo. Thank you, everyone. Yes, can I share my slide now, sir?
Is there any problem, Divya?
No. I hope you are seeing my slide now.
Yes, you can go for slideshow.
Yes, right.
I welcome Stina Anderson from Sweden. Welcome, Stina.
Thank you so much. Nice being here.
The slides are clear, right, sir?
Yes, absolutely clear.
Right. So I'll just here, dears, we are going to speak about the word Arthava Virama, that is related to the menopausal. And here myself, Vaidya Divya from Ayurveda College, Coimbatore. I'm working as assistant professor from the Department of Agata Tantra in this college. So I am starting with my topic today. As our many relevant organizers told, this is the beautiful day where we respect the ladies. And I start with this beautiful slogan, which we are very familiar with, is Yatra Naryastu Pujyante Ramande Tatra Devadaha. Right. I hope we all are blessed with the presence of the God together with us, because we are together, put together our hands to speak about the menopausal syndrome. That is very, very important for the ladies, right? Yes. So here onwards, I will be exploring mainly on focusing on the menopausal. But before entering to the menopausal phase, discussion about the content of the menopausal syndromes and all, just to taking your attention towards the reproductive life of a woman, right? So when you think how the life of a woman is carrying on from the puberty phase into the menarche, then coming to the fertile phase, that is where we feel the menstruation, ovulation, and everything. That afterwards, giving the pregnancy, babies, their lifestyle, everything we goes through, and we end with the phase of the reproductive life of a woman with menopausal phase, right? So we are here to discuss about this menopausal phase, right? I hope everyone are seeing some pictures of menopausal in the screen, right? I feel it is very interesting to tell you that whenever we sit in the clinic, our patients will come with these witches. Doctor, I am having itchy problem. I am having bitchy problem. I am having sweaty. I am having sleepy problems, bloated, forgetfulness, psycho. So, dear friends, these all 7 witches, I would like to say that these are the 7 Buddhas or witches which catch out during the menopause. So, commonly we get many questions like this. Menopause is a disease? The patients will ask you, Doctor, I am reaching to the menopausal phase. Is it really a disease? Actually, what is taking place in my body? Can you explain me? Can you give me some proper diet plan or some of the exercises, what I can do to regulate my problems? Can you suggest me some of the simple preparations which I can make in my home, which will regulate all these witches' problems, right? Dear friends, I am here to explain you some little bit concepts of these menopausal syndromes, which I would like to categorize under these 7 Buddhas, 7 witches, which will attract you or which will make you more complicated during the menopause. Okay? Right. So, dear friends, as we are in the platform of the Ayurveda, I would like to take up the menopausal syndrome along with the explanation of the term Arthava Virama. And I hope everyone is very familiar with the Arthava Virama. Arthava means menopause, Virama means cessation or completion or stoppage. We sometimes use another word, which is Rajo Nivarti Kala. That itself, Rajo means Raja or Rajas means it is menstruation. Nivarti means cessation. Kala means it is a time period. So both the words like Rajartava Virama, Rajo Nivarti Kala, all these terms are very, very, very much related with the menopausal condition. Right. Here, when you want to read more about the Arthava Virama references, I just made a slide for you to go for more references from the Ayurvedic textbooks. Our Sushruta Samhita Sutrasthana, 15th chapter, which exclusively discussed about the recta, blood, all these concepts. You can go through that. How the recta dhatu is formed, how the artava is formed, everything is explained in that chapter. And Kashyapa Samhita, 9th chapter, very detailedly explained about some concept of the artava virama. What are the factors related to the artava virama in this chapter? So Shuddha Samhita, Sharirasthana, 3rd chapter, when it is relating, explaining about the Garbha and all, they explained very beautifully with this concept of Artava Virama also. So you can have it more references from the slides. Right. Yes. Here is a very beautiful question. Always what we face when we see the patients about the menopause. Sometimes when we are gathered in a group of people in some functions, or sometimes in the clinic, wherever you go, when you see the ladies around in and around the age of 40s, 50s, they will ask us very common question, Doctor, I am having some problems related to the menstruation. Is it really because of the menopause? When I will be getting my menopause? What is the age of Artava Virama? Right? So if you ask me, as how Ayurveda looked into this Artava Virama, what age can you explain to the patient? Can we actually stick on to one age? If you ask, no. We can say that it is in and around about the 50, but I always emphasize to the beautiful concept of Kashyapa Samhita, what he explains about the age of Artava Virama is that specific, it is influenced by, it is get controlled by specific diet pattern, specific lifestyle, specific health of a person, the desha, prakriti. It's a wonderful concept of Ayurveda. Where the prakriti, the body constitution can say how you will get the menopause, how you will face the menopausal problems. Your desha will say you about the lifestyle, health, the diet will say you how you will get into these syndromes. So always I strict down to these answers. I observe these points whenever the patient says about the menopausal syndromes. Right. So this is just a slide made for every Ayurvedic people to just understand that how the Artava Virama, we look into that in the Ayurvedic concepts. Artava, everyone knows it is the Ubhadhadu of Rasadhadu. And when the Dhadu Agni, Bhudagni acts on the Rasadhadu, it will be converting to the Rekta as well as the Ubhadhadu Artava. So whenever the second part of the Artava is getting exhausting, is getting depleting, or Kshaya is happening, it means that it is the Uttarottara Dhatu Kshaya. That means the rasa may be depleting. The rasa will be depleting how? It is related to the aging. It is related to the kalaja, vriddhavastha, and thus how the rajo nivritti happens as per Ayurveda. So whenever I explain the concept to the common people, I will use the simple example of a mango. How the mango or fruit, whatever the fruit, a small fruit will get up into a big fruit, and how it get up into a pulpy, juicy mango, and last when all the extract is taken out, how it will get dried up. The same way it is taking in our life. Okay. So dear friends, as we are very much strict on to the Artava Virama concept here, let me see the symptoms of Artava Virama. So these are all the points or the symptoms what we mainly see in the clinic. That's what I suggested here in this slide. Can we look into that? Shoshana Kshaya of Dadus. That means what? The Kshaya, the depletion of the Dadus are happening. Indriya Kshaya, the Kshaya or depletion or the strength of the sensory organs are depleting. Balakshaya, Virya Kshaya, all the things when you see Kshaya word is using. That means what? I told you previously, when a later side, later. Hello?
Yes, please
Yes,
proceed.
yes. It is the nothing but the depletion of the dhadus. It is depletion of the strength of the sensation, strength of the tissues, strength of overall strength of the person is getting depleted. That is the first point, depletion. Next, what happens? It is the depletion of the medas and mamsa dhatu even. How it happens? Rasakshaya, automatically the raktakshaya will happen. As the arthava also ubadhadu of the rasa, the kshaya will happen. Then next after the rakta, next mamsa is coming, maidho is coming. Slowly the other preceding dhadus also getting influenced by this kshaya avastha. Then if kshaya is happening, what dosha will be aggravating in that condition? It is nothing but vada dosha. That's why when you observe most problems of the symptoms of the patients during the menopausal syndrome, when you say menopausal condition, it mainly related to the vada disorders also. Right. That's why joint pain, pradhana vyadhi as the shula, sandhi shula, everywhere the pain, they will contain. Then here's a question, like not only the pain, what comes the other symptoms? The symptoms like the patients will say about the tenderness, the stiffness, sometimes about the hot flashes. Then where comes all these symptoms of menopausal syndrome? Where you fix this condition? Dear friends, Kshaya is happening, Vada Vriddhi is happening. Once the Vada Vriddhi is happening, automatically all the dhadus, all the doshas will get triggered out, and the flow of the negativeness, the flow of the things will go into the preceding the doshas. Like once the Vada get agitated, it will go and irritated even from the Agni. Amashaya Agni. Then what happens? That energy, that thing will irritate the pitta, and pitta dosha will get agitated by the excessive vada dosha, and flames of the pitta will go out all over the body. Just like if you give more vada, air to the fire, it will flame up. The same way the body will get exhausted with the hot flames. Just taking you to the way of the symptoms, right? This is what I explained about the dhadukshaya, depleting the preceding dhadus, like dhadukshaya happened in the rasa, preceding to the rakta, then maidas and mamsa dhadu, it continues. The kshaya avastha starts from the rakta dhadu. Then what happens? The aggravation of mainly the vada rogas can be appreciated during the menopausal syndrome. Right. Yes. I told you about the dhadukshaya, vada vriddhi. Then next, what is the concept? It is related to the ama formation. Here, everyone will raise a question. Can really the ama formation may happen during the menopause? When you are telling about the kshaya avastha, then how the ama will form in this condition? Dear friends, when the vada is get aggravated, normally, as I told you before, it will go and irritate the Agni. It will flame up, and one point it will come, it will reduce, it completely extinguish the Agni. Then what happens? Mandagni will start over that condition. So then what happens? The Mandagni, it starts from the Amashaya, the Ahara Pajana itself will get complicated. The Mandagni will lead into the Amavastha in the Koshta. There onwards, the problem starts. It starts with the Amavastha in the Aharas, then later stage, the Rasa is getting Amavastha, Rekta will go for the Amavastha, then moving even into the Medas and Mamsa Dhatu Amavastha. That's why some of the patients will go for the problems related to the menstruation, menopausal syndrome, the obesity conditions come over there, digestion problems come over there. All these things as the time progresses. This I already explained you about the Vada Roga. Whenever the Kshaya happening, there arise our culprit Vada. So first we can see many problems related to the Vada Roga, many problems related to the Ama related condition like Mandakni related problems, many problems related to the Vada and Kapha related problems. Later stage, it goes even to the Medhas and the Dushti of the Mamsadhadu, which land up with the obesity conditions also. Right. So just I glanced over the conditions like Kshaya Avastha, Gnimandhya, and the diseases mainly comes under as Vata. But here is a very, very interesting thing. I just add over one slide over here to say you that even in the first slide, I mentioned about the Kashyapa Samhita, he mentioned a word like Prakriti, the body constitution, how the body constitution can relate into the Artava Virama. Can really the Prakriti of a person having a connection with the menopausal syndromes and menopausal dates? When I will get the menopause? This answer is very beautifully, you can answer with the Prakriti analysis. If a Pittaja person, how their menopause will be? As their Pitta content is aggravated, they will go for the easy early menopause. But the fact is that the problem lies in the condition where the Pitta Prakriti person will get more problems related to the Pitta. There, the hot flashes, excessive perspiration, thirst, anger, short temper, like that. But on the other side, the person or the woman with the Kapha predominance Prakriti, how they will go and manifest with this Artava Virama syndromes. And when they will get, is it an early or late? Is it because it is the Kapha Prakriti person, they are most of the time, they show a little delayed menopause and they will be having the menopausal symptoms like weight gain, very sleepiness more. They have the swelling like problems like Shoda, all those things excessively. Dear friends, this is a hint for you. You observe the Prakriti, it gives you more interestingly, you can analyze the Artava Virama symptoms. Yes, next about the Vada dosha. If a person is Vada Prakriti person, exactly their time of menopause will be in the question mark. How it will be sometimes early, sometimes very late, just like the Vada character. But one thing is very much observed with the patient. If they are Vata Prakriti, mostly they will be going for excessively of the motor neuron problems like psychological, sometimes like psychological problem disturbances, irritability, depressions, mood swings. Very common with the Prakriti of the Vata persons. More than the Pitta and Kapha persons, when you observe the menopausal syndrome, it is very interestingly what we felt in the clinic is Vata persons will be having always this type of the mood swings. So this is a very beautiful concept. What I felt when I observe with the patients, when relate the Prakriti and the Artava menopausal symptoms, this gives you more interesting to explore the concept of menopausal syndromes. Just doshic base, what we explained. Just these are the slides which explains you the doshic base, what all the symptoms you can see very interestingly. Just I explained like nervousness, anxiety, mood swings, all related to the nervous contents. That will be more actively you can see, and when you observe the doshas, Vada dosha pradhana Artava Virama. It may be a Prakriti related. And sometimes even in the clinic, when you observe the characters of the menopausal syndromes, you can categorize that into Vata, Pitta and Kapha. And when you categorize into Vata, Pitta, Kapha, you can very beautifully pick out what dosha is predominant in their menopausal condition, and accordingly you can give the treatments. And that works very wonderfully. Right? If you have this list of symptoms in one category, you can go through each characters, and if you can explore the type of the dosha is involved in this condition, and very interestingly, you can go for the medicaments and the diet plan, everything related to this condition, right? Yes, we know what to be given when the Vata Prakriti is more involved in that, like Vata conditions have to be regulated, just like increasing the warm food like our Ushna, or the characters like Lagu, Ushna, Vishram, that characters which is opposite to the Vada to be given to balance the condition. Lifestyles also accordingly, right? Some of the herbs what we practically use in the clinic for the, if I categorize and see the characters of the doshas, if I give more weightage to the Vada dosha, I will go for some of the medicaments like Ashwagandha, Arjuna, our Ela, and Gugulu. All these things we will be giving to the patient in many forms, like Arjuna Kshira Paga you can give, Ashwagandha for their churna with the Kshira you can give, and sometimes the Gugulu tablet something to be given, and all this will regulate the Vada. Similar the side, the problems of the menopausal symptoms will be regulated. So it is very interestingly, we can categorize that into the Vata, Pitta, Kapha, the symptoms slide, and accordingly we can treat in a, we can give a dietary chart, we can give the herbs which we can select accordingly, right? This is about the Pitta Dosha Pradhana Artava Virama. There what happens, more of hot tempered, hot flashes, night sweats, very excessive bleeding in the initial stage, skin rashes, acne. So what you think, and you can find it out that the Rekta dosha also happening in this condition. There I just connect that with the Ama condition also, with the Rasa Kshaya Avastha also, then you can very beautifully pick out that Pitta Dosha Pradhana condition, the menopausal symptoms, means syndrome problems are happening. There you have to tackle it with the Pitta, Rekta Dosha, and even with the Agni. These three things you should keep in your mind when you are doing with this Pitta Dosha Pradhana Artava Virama. It is very, very difficult to deal with the Pitta Dosha Pradhana because the patient will be very much eagerly waiting for a easy, very fast relief. Why? Because sometimes in the clinic, the patient used to come and say, Doctor, I used to put wet clothes in order to reduce that hot flashes, the hot feeling of my body. If I put the fan in full speed, also I am not at all getting, I'm getting the sweat all night. I'm not able to sleep at all. So what we can do? Just understand that the Pitta dosha is degradating in that condition, and we can give our ahara, vihara according to the Pitta dosha. And some of the herbs what we commonly add to that is Kadhali, very beautiful Kadhali. In one of the pharmacy like Shantigiri, they are having the Kadhali Kalpa Rasayana, that is the Lehya form. I used to give this Kadhali Kalpa Rasayana Lehya to the common people whom I feel like more predominance of the Pitta menopausal syndrome. And even we mix some of the medicines like our Nalpamaradi Kashayas, all the things which were Ushira Asava, were all the things which regulate the Pitta mainly, increase the Agni and balancing the Agni and correcting the Rekta dosha. These three things always keep in my mind when I used to get the patients in the Pitta Artava Virama category. So you can see out some of the medicines like our Ikshu, Kadhali, Nimbha, Punarnava, all our Kshiri Rikshas, Arjuna, Chandana, very beautiful medicine. Because in many patients under this Pitta menopausal syndrome, they will always complain about repeated urinary infections. And I found very wonderful result with the Chandana Asava and Ushira Asava combination. Sometimes the Shadavari Gula we give along with that. And when we start with the Shadavari Gula, their feeling of temper, everything will get reduced. Very wonderful. They used to say, Doctor, the sweating of my hands reduced, sweating of that burning sensation of my body reduced. So what we can do? What we are doing? Just understanding the dosha over that menopausal condition and tackling with that. Right. Next, we completed Vata Pitta and we are going to the Kapha dosha mainly. Right. In the Kapha dosha predominance, we can observe that some patients will be having the body weight gain, lethargy, swelling, all over the body swelling. They feel like I'm getting to the 40s and 50s, I'm feeling a swelling all over my body, always feeling to laziness, feeling very depressed, not at all motivated. I'm feeling very slow in my mandakni, slow in my digestion. What we can see in this condition? Exactly like opposite treatment, whatever the treatment give for the ahara vihara for the kapha, and I move to the medicines. When you look into the medicine, as their kapha predominance, we can go for a simple virajana procedure along with the agni igniting. Then Aranda is a very beautiful medicine I used to give in this condition, mainly for some of the type of the Aranda preparation like Hindu Triguna, or sometimes Sindhuvara Eranda. If you're not at all available, even you can go for the Nimbhamradadi Eranda. Like those Eranda preparations, if you give, the Kapha Vada regulations will happen. Automatically, some type of the igniting of the Mandakni will be corrected out. And that clears the Srodhas. And that help them to recover, just cover up the menopausal syndrome very beautifully. Right. This is what I am telling about the Panchakarma as total. When you think about the Panchakarma during the menopausal, we can go for the Virechana, Vasti, and Nasya, Shirodhara. Nasya, when you go for the IP treatments, we usually may stick on to the Virechana concept. Sometimes if it needed more of the Vada Pradhana, if I feel I stick on to the Vasti. And sometimes after the Virechana, when feel like Vada is aggravating, we can stick on to the Vasti in the later stage also. Along with that, for the Nasya, Shirodhara as a treatment, they calm their mind-related conditions. Right. Just 3 slides I am having, like 3 important problems what we feel in during the menopausal syndrome. We already discussed in the Kapha, Vata, Pitta, Kapha, but I stick to the mainly 3 problems like obesity, mind-related problems, hot flashes. I will just glance over that and we'll finish. Right. Obesity management, as I told you, it is mainly of the kapha predominance and the mandakni it was started with. And what we suggest for the obesity is we can go for the yoga exercises. And very important thing is stick on to the dietary pattern, pacifying the kapha predominant. Kapha things to be reduced and make them to clearly eat timely. This is a very common thing what observed in the menopausal patients, right? When they feel like obesity is increasing, they are feeling like some stoutiness, they will completely skip their meals. Dear friend, I am not telling you to eat more, or I am not communicating the concept that eat more during the 3 times, but you should not vacant, you should not leave the stomach as vacant. Should advise them like that. Why? Because once you keep your stomach as vacant, the Agni will get more complicated. In that condition, the 3 satisfying meals at a small quantity, at least minimum, and that also very much specific to the kapha predominance and kapha pacifying diets you can suggest. Right. Pranayama, Nadi Shuddhi Pranayama, mindful meditations, other asanas like Vakrasana, Sedubandhasana, Bhujangasana, all these things what will do, it clears out the Shrodhas and more of Agni Deepana will start from there and Amashaya. Right. So this is very common, but we observe in the obesity related conditions, tackle to it with the kapha related conditions. Next comes the mind related problems. When I think about the mind-related problems, I always remember one very beautiful story which I used to hear from my guru. He used to tell that mind-related, how it can be related to the menopausal. It is very, very interesting. I always remember this story. It goes like this. It is a very beautiful nest. and a very beautiful nest. A bird was having the egg, and eggs are kept over by the mother bird, and she gave all the warmth and everything, and one day that eggs hatched out. Then what happens? That hatched out birds will be trained by the mother, and one beautiful day will come, all the little birds will wing their wings and they flies away from the nest. This is very, very interesting. There is the vacant nest syndrome, vacant nest feeling. As a feeling like that, they are alone in their menopausal time. This is very much influenced during this period. That is why the mind-related problems are very much we can see in the clinic. And when you look into this mind-related problems, when you categorize it, what we found it is that the anxiety, anger, and depression. Always, when we see the patients, we can stick into either of these three categories. There may be very much anxious, there will be very much angry related things. On the other words, it is depression related. When you say to the anxiety things, I used to communicate that with in my concept, it related with the vata more, and anger, pitta related, depression or shoga, sadness, these things will related with the kapha predominance. Then there's a wonderful combinations what we can use and practice in the clinics. That's why the Shidha Virya Medhya drugs and Ushna Virya Medhya drugs. Shidha Virya Medhya drugs is very much interestingly, it is very much useful in the conditions like in the anxiety and anger, where the Vada Pitta involvement is more. Where Mandoka Parni, Shankha Pushpa, Yeshti Madhu, Brahmi, Kushmanda, even Kushmanda can be incorporated. When you stick on only to the Charagha Medhya drugs, we can think about the Mandoka Parni and Yeshti Madhu. It is a very wonderful combination you can give. And when it comes to the depression, anxiety, depression conditions where kapha predominance are there you can think about the Ushna Virya Medhya drugs, where Guduji, Haritaki, Vajja you can consider. And when you stick on to the Charagha, our Medhya drugs, you can take it out as Guduji. How you can give? Mandoga Parni. You can give the Mandoga Parni in a form of Swarasa or Churna. This is the dosage like 10 to 20 ml and 3 to 5. 2 times or 3 times according to the condition, you can give. Yashti Madhu Churna. Churna is 1 to 3 grams. And what the Acharyas are specifically telling about the Yashti Madhu, we can combine with the Kshira and give. It's wonderful Anubana. In Charaka Samhita only they explained. When it comes to the Shankha Pushpi, they are advising about the 3 to 5 grams. Surasa, it is the 10 to 20 ml. And Fanta Kashayas, if you can give also. When stick on to the Guduji, as I told you, in the depression condition, where the kapha predominance is there, we can go for the Ushna Virya Medhya drugs. That is the Kvada preparation of the Guduji Churna, or even Sattva preparation also, we can give. And some of the medicines, when you go through these medicines which we commonly use during the menopausal syndromes, whatever the categorization comes, like Brahme Gridha, Medha Rasayana, Shiva Gudika, Phala Gridha, and all, you can see that all these medicines, it includes some one or the other Medhya drugs. Either it may be Ushna Virya or Shidha Virya. So you can, accordingly, you can select the best one in from this category. Right. Next
Light
about
fast.
Yes, I am concluding.
More time.
Yes, hot flashes. Next about the hot flashes. Yes. During the hot flashes, we stick on to the Pitta Shamana categorization or the medicines, Chikitsa based on that. There's a Nasya with Kshira Pala, Chantana Taila, or decoctions according to the Pitta Shamana. Virajana is the best treatment. Gridapana, all these things. Shavasana is the best treatment. Yes, a Yoga Asana. And when you look into this, when there's a clinical evaluation, one paper, when we look into that, we got it is Ashogarishta, Ashogandha Churna, and the Pishti of the Pravala Pishti, and you know that these three things in the combined form, this paper link you can connect, and from this paper link you can read more about this condition, these combinations. And it's very obviously, it is very clear that all three things are tackling towards the three doshas. Okay. It's seven things, and mainly related to the hot flashes. When you think Pravala Pishti is a wonderful medicine, which when you add to any combinations, it will regulate the Pitta and ignite the Agni. The Mandakni will be corrected from this condition. Two homely preparations I just had to hear for the interestingly. It is methi laddu, that's a phenogram. The preparation is there. You can mix the phenogram 50 grams and powder it with the jaggery, and you can make it as a bolus. And we used to give this as a laddu formation. It's a bolus formation forms. You can give as a dessert, and it's a wonderful medicine. As a preparation, you can take it from the during the this late ages of your time. It is a wonderful thing. This tilla laddu, it is very common in India. We use these things. So just menopause, it's nothing but the nature's wake up. It's a wake up call for you to pay more attention to your health, more attention to yourself. It's a time for you to think about yourself. So take your help of the Ayurveda and be healthy. Thank you, one and all.
Thank you. Thank you very much.
Thank you, sir.
Excellent flow and excellent flow of information. Both.
Thank you,
God
sir.
bless you. God bless you.
Thank you,
All
sir.
the best for your career. God
Thank you,
bless
sir.
you.
Thank you, sir.
Very nice. Now, without wasting, thank you. Thank you for introducing Dr. Ramdas and Dr. Varagiji. Thank you. Thank you. Now I would like to request Dr. Anjaly, MB. Dr. Anjaly. Am I audible to you?
Yes, sir. Yes, sir.
Welcome. Welcome, Dr. Anjaly.
Namaste, sir.
Namaskar. Dr.
Sir, hope,
Anjaly,
sir, hope
MB.
I,
Yes, welcome.
yeah,
Your slides are visible.
yeah, okay. Thank you. Thanks.
Thank you, Dr. Ramdas. Thank you very much.
Good evening to one and all. Sir, may I start?
Yes, yes. You are most welcome.
Yeah, good evening to one and all present here. First of all, I would like to extend my sincere thanks to Ramdas sir and Pavan Kumar sir for giving me such an opportunity on this great platform and to be a part of this continuous learning process. And without wasting much time, I am going to move on to my presentation. Through the glimpse of a cross-sectional study, which was conducted in Haryana. Actually, this study aimed at assessing the menopausal symptoms, the prevalence of menopausal symptoms in rural middle-aged women. And this study was conducted in 2019. And it was found that about 87.7% of the women experienced menopausal symptoms. And this itself highlights the importance of celebrating this very special day, that is the World Menopausal Day, because majority of the women who are moving or who are in the journey through the menopause experience various symptoms, and it is our duty to address them and to give them all the comforts what we can do from our Ayurveda side. WHO has defined menopause as the final menstrual period, that is the permanent cessation of menstruation resulting from the loss of ovarian follicular activity. Menopause can be diagnosed only retrospectively. Why? Because 12 months of amenorrhea only confirms menopause. If a patient is coming to us with 6 months or 4 months or 8 months of amenorrhea, it will not confirm menopause, whereas 12 months of consecutive amenorrhea will only confirm the menopause. And hence, the diagnosis is just a retrospective one. And here we can find that it is due to the loss of ovarian follicular activity. Actually, the ovary contains many number of follicles from the intrauterine life itself, which is continuously degenerating or depleting in its number throughout the reproductive phase. And by the end of the reproductive life, that is by the menopause, the quantity and both the quality of the ovarian follicles gets depleted. And this can be assessed. This menopause can be assessed both biophysically and biochemically Biochemically, we can test the hormone values like a follicular stimulating hormone, which will be very high in case of menopause, and anti-Mullerian hormone, which will be very low. And similarly, radiologically through USG, we can count the ovarian reserve or the remaining follicles or the antral follicles in the ovary, that is antral follicular count, which will give us an idea about the reproductive aging of that woman. If the antral follicular count is very low, it indicates that the woman is going through the menopausal phase. And usually this antral follicular count and the AMH value will be high, or AMH value will be constant in throughout the reproductive phase, which will become low or decreased in during the menopause. So these are all the biochemical and the biophysical factors with the help of the history, which helps us to confirm the final menstrual period or menopause. A pan-India survey conducted by Indian Menopause Society found that the average age of menopause in Indian women is much lower than that of the Western counterparts. Actually, it is 46.2 years in Indian women, whereas globally or in Western women, it was found that it is 51 years. These are some of the terms which we often use along with menopause. That is pre-menopause, post-menopause, menopause transition, perimenopause, or climax. WHO has tried defining all these terms because in our day-to-day clinical practice, we are supposed to classify the women or a patient who are coming to us with the menopausal symptoms in all these different stages. It is just not vaguely, we cannot consider a patient as a menopause woman. She may be anywhere in the journey. She may be in any of these stages. So perimenopause, according to WHO, is any period which is the period which comes both sides of the menopause. If the final menstrual period or the menopause is considered as a central point, perimenopause includes both either side of the menopause, that is premenopausal period and the postmenopausal period. So it starts from the period from where the patient starts experiencing any kind of symptoms, menopausal symptoms. It can be irregularity in the menstruation, or it can be any symptoms like hot flashes or mood swings or any such symptoms. The point from where the patient starts experiencing these symptoms and up to 1 year after this final menstrual period is considered as perimenopause. Menopausal transition is also somewhat similar to perimenopause, but it is only till the final menstrual period. So menopausal transition includes those time where the patient is experiencing all these symptoms and irregularity in menstrual cycle at its peak. So it is the period immediately before the menopause where all these symptoms are in its high intensity. Post-menopause is the menopausal period after the final menstrual period, and it extends up to the demise of the patient. And climacteric is yet another term which was used in the initial time, and WHO strongly suggests that not to use this term climacteric in the scientific discussion or in research activities, and hence we are not going to use the term in this presentation. And this is another advanced classification of the menopause, that is stages of reproductive aging workshop, which was conducted in 2001, classified the reproductive aging in 7 different sections. This was done in order to avoid the further confusion. Still, even after the definition by WHO, researchers were confused where to keep the women who are coming to them, or where to include the women and which stage they have to consider these women during their clinical practice as well as in their research studies. So in order to avoid these confusions and to bring more clarity on towards the staging, the stroke criteria was established in 2001. And the stroke criteria again keep the final menstrual period or the menopause as the central point, and 5 stages is considered before the menopause, and 2 stages is considered like after the menopause. So -5 to -1 will come before the menopause, and in this, there is -1, -5 to -3 indicates the peak reproductive phase, and -2 to -1 includes the perimenopausal phase, and +1 to +2 includes the postmenopausal phase. And why this stroke classification is important? Like if a patient in this stroke criteria itself, if you can see in the late menopausal period, the patient experiences an amenorrhea of 60 days or more. So if a patient is coming to us with amenorrhea of 60 days or more, and if we are going to look their follicular stimulating hormone FSH level, and it was found more than 25, and her AMH level and antral follicular count was low, we can classify her under the late perimenopausal period. And the advantage is that the late menopausal period is 1 to 3 years before the menopause, and which helps us to predict the possible date or possible year of menopause. Here we'll get an idea when this patient will be moving on to the menopause, and this thereby we can plan the management of that patient. It can be to perspective. And while discussing the stroke criteria, we cannot omit. Sorry, sir, am I audible?
Yes, yes.
Yeah.
Your voice is breaking due to net, but
Yeah, some
excellent,
network issues.
excellent.
Yeah.
Please proceed.
Yeah. Yeah, thank you. So while considering the stroke criteria, we cannot neglect this age classification which is given in our Samhitas. And this is yet another detailed classification of the reproductive aging we can tell. In this Madhyama Avasthas, which is still further classified into 4 different stages like Vriddhi, Yavana, Sampurnada and Parihani. And Sampurnada is up to 40 years where all the Dhadu, Indriya and all the potential factors are in its Sampurna Avastha. And Acharyas have explained that after this 40 years, there is gradual decline in all these factors like Shina Sarvadhatu Indriya Bala Ulsaha Heenatva happens. So this can also be considered as a gradual reproductive aging. And in the Sampurna Avastha at the 50 years of age, the menopause is considered as that the Rajonasha happens. Again, this is another classification of reproductive aging which is available in our Samhita. Sharangandar Samhita explains Bhalyam Vriddhi Chavir Meda Swag Drishti Shukra Vikramo Buddhi Karmendriyam Chedo Jividam Dashato Haset. That is, in every 10 year of age, we are losing each of these factors. This can also be considered as a reproductive aging or staging, which is available in our classes. And even after explaining all these details about the ages, the 12 year is considered as the age for menarche, and 50 year is considered as the age for Rajonasha or the menopause. But still, Acharya explained this term Prayiga method. I don't know that I has explained this term Prayiga method in the commentary, which explains that even these ages are subjectable to changes, which means it can happen either early or it can delay. It can be delayed. So comes the concept of premature menopause and the delayed menopause. So the menopause, which is the average age was told as 46.2, even it can happen before that, and even it can be delayed. So these are the natural or normal variations of the menopause. So here the premature menopause is explained as the menopause which is happening before the age of 40 years. And this is a very important entity which we usually encounter in our clinical practice. And nowadays, many women are undergoing through this premature menopause due to many factors. So more researches are being done on this premature menopause, and it can be either surgically induced or it can occur due to many other factors. Surgically induced means due to hysterectomy or due to oophorectomy, the women undergo menopause in an early phase. And in other causes like genetic, autoimmune, infections, iatrogenic. Iatrogenic means if the patient is undergoing repeated laparoscopy or if she has to undergo chemotherapy, which results in ovarian insults, all these factors will result in a premature menopause. And here comes the role of the role of Ayurveda, wherein some of the modifiable factors can be tackled with Ayurveda and can be modified and help the patient to overcome or to delay the menopause a little bit more. We can delay the menopause a little bit. What happens in the premature menopause is their follicular activity is lost even in early to late 20s or even in early 30s. So many of the women will have to undergo infertility treatment, And finally, what happens is they are left only with the option of donor egg and IVF through a donor egg. So they will have to get a donor egg and undergo IVF due to the depletion in their ovarian follicle, either in the quality or the quantity. And we usually get so many patients coming to us in our daily practice to inquire whether Ayurveda can do anything to enhance their quality or quantity of the follicles. One thing is that we cannot increase the number of the follicles, but I think we can improve the quality of the follicles, which was evidenced from a case report. We have published it in PubMed journal, and this was published in 2017. Actually, after this, we got many patients, and those results have been documented. And here, the anti-mullerian hormone, which is considered as a diagnostic criteria for premature menopause or premature ovarian follicle, could be improved to a significant level in a patient who was advised to undergo an IVF with a donor egg. But after the patient underwent the Ayurvedic treatment, she was able to do the IVF with her own egg. So this itself indicates that there is an immense potential in our hand where we can help these patients who are facing premature menopause, and we can support these patients through Ayurveda. And more researchers has to be focused on to these problems. And after discussing all these basic concepts of menopause, excuse me, we can now move on to the menopausal transition phase. Menopausal transition means wherein the patient is starting to experience all the clinical symptoms of the menopause. The various symptoms can be due to the changes in different levels. It can be either at the level of the HPO axis, hypothalamo-pituitary ovarian axis, or it can be at the level of the bone metabolism. It can be at the level of the endometrium. So all these changes can be classified into early changes and late changes. Early changes includes hypothalamo-pituitary ovarian axis change, ovarian changes, central thermoregulation changes, endometrial changes, weight gain and fat distribution changes, and lower reproductive tract changes. Due to the, in order to stick on to the time which is given to me, I will be only explaining about the early changes and the menopausal symptoms experienced under these early changes throughout this presentation. So first we will move on to the changes which is happening in the hypothalamo-pituitary ovarian axis. So in a normal menstrual cycle and during the reproductive phase, the HPO axis, that is hypothalamo-pituitary ovarian axis, has to work in a synchronized manner in order to produce a good ovulation or in order to have a good follicular genesis. But in case of menopause, what happens is the pulsatile fashion of the hypothalamus or the synchronized secretion of the gonadotropin releasing hormone is lost, which in turn result in impaired timing of LH surge. And along with this, the follicular stimulating hormone levels start increasing in the body. This is due to the lack of negative feedback which is coming from the ovary. Ovary contains very many follicles, and the follicles has to respond to the hypothalamic hormones, that is, the pituitary hormones, that is LH and the FSH. What happens in the menopause is, even though the remaining follicles may be less number, either in the quantity or the quality, even though the ovarian hormones are less in number, they will become resistant towards this pituitary hormones. So these hormones, the folliculogenesis will be defective, and the ovarian steroidogenesis, that the production of the estrogen also will come down. So the estrogen has to, normally the estrogen has to give a negative feedback towards the pituitary, and which controls the level of the FSH and the LH. Here, all these coordinated control of the hormones is lost normally in the menopause, and finally the FSH start increasing and the folliculogenesis is not proper, and finally there is no ovulation and the patient start experiencing irregular menstruation and finally amenorrhea. And coming on to the ovarian changes, actually the changes in the ovary or the aging of the ovary starts from the intrauterine life itself. That is, from the 20th week of gestation itself, the atresia of the follicles or the primordial or primary follicle starts. Means aging of a female even starts from her intrauterine life. We will have to say like that, because at the 20th week of gestation, it is about 7 million follicles will be there in an ovary, wherein it will come down to 1 million by birth, because continuous depletion in the number or the atresia is happening. And by puberty, there is only 3 lakh follicles which is available. And by pre-menopause, only less than 1,000 is only available in the ovary. So that is why antral follicular count, wherein which is the marker of the ovarian reserve. How much reserve is there is being measured by the antral follicular count. That is usually measured in the day 3 of the cycle, but it can be measured in any time. Like in menopause, we usually used to, in an amenorrheic cycle, we will have to measure it and to find out whether there is any number of follicles which is remaining in the ovary. So this gives us an idea about how the aging of the women or the reproductive aging. So this is how the menopause is happening. Continuous depletion of the follicle happens throughout the reproductive phase, and finally the woman reaches a phase where there is no follicle remaining to ovulate, and thus she reaches in a stage of menopause. Next, coming on to the changes in the central thermoregulation. And the changes in the central thermoregulation result in the vasomotor symptoms, which will be presented by the patient as hot flashes followed by a sweating. So episodes of sweating. This is the major complaint which is presented by the patient in our day-to-day practice. Majority of the patient present with this complaint. The incidence is found that about 75 to 80% of the women is experiencing this vasomotor symptoms, which is characterized by a feeling of heat or burning in the face, neck, and chest, and followed immediately by an outbreak of sweating. So there is a feeling of heat followed by an outbreak of sweating. And the duration can be up to 10 minutes. It can vary from anywhere between 2 to 3 minutes or 5 minutes and up to 10 minutes. And it can even come in every 1 hour. So this itself indicates the intensity of this problem. Every 1 hour, if the patient is undergoing through such kind of problem, it will definitely disturb her quality of life. It will disturb her sleep, and it will disturb her routine day-to-day activities. So actually, more researchers have to be focused on to this problem. And even again, Ayurveda can do many wonderful miracles regarding this. We can make various internal medicines like Drakshadi Kashaya, which is indicated in Jvara Chikitsa, Ashwagandha Churna, Shatavari Churna. All these are having like a significant result in this complaint. But the thing is that no such evidences have not been documented in the literature, and hence the society won't be beneficial. So as much as we are getting the results, we will have to do more researches and based on all these parameters, and we will have to document in or we will have to publish. And this is the hypothesis, which is because the reason for the hot flashes have not been found out. From the studies, this is the latest hypothesis which we can find, because some not only it is not due to the estrogen, decreased estrogen level, because during the menopause, whatever happens, we completely blame estrogen. This hot flashes, but we cannot blame the low level of estrogen only. It can be due to the narrowing of the thermoneutral zone. Normally, we have a thermoneutral zone, and in the menopausal women, those who are experiencing the vasomotor symptoms, their thermoneutral zone can be a little bit narrowed, which triggers the intermittent heat loss mechanism and the shivering mechanism. And along with that, neurotransmitters like norepinephrine also plays an important role in hot flashes. Why this hypothesis was formulated, based on a fact that antihypertensive medicine like clonidine was found effective in hot flashes, which indicates that not only estrogen is responsible for this hot flashes. While coming on to the Ayurvedic perspective, we can find that it is described that there is a gradual acnemandia which is happening with the aging. With the acnemandia which is happening with the normal aging process, resakshaya, that is dhadukshaya, is happening. And in the resakshaya lakshana, we will get the symptom trishna, which means udakapana abhilasha. Again, the patient who is undergoing these vasomotor symptoms have this feeling of trishna. And in Raktakshaya Lakshana, we will get Amla Shida Prarthana and Siddha Shaidilya. So together, all these can be compared as the vasomotor symptoms which we see. And here, Raktakshaya means it is not just the whole Raktakshaya. It is in commentary, it is explained as the Udaka Dravatva of the recta is being decreased. And hence the patient is having the Shida Prarthana. And Tejo Vriddhi is still there. And that is why the patient is having the Shida Prarthana. And in Raktakshaya, there is Vada Vriddhi. That is why the patient is having and like crave towards the amla rasa, because tatravya marudam nandi. So all these factors helps to plan a good treatment protocol for these patients. And altogether, Susurdacharya have explained, for all the Dadukshaya, we have to plan Swayoni Vardhana Dravyopayoga. Like as I already mentioned, Drakshadi Kashaya, which is mentioned in Jvara, and Ashwagandha Churna, Shatavari Churna, Shrirabala Taila, and all these medicines actually helps and in controlling all these symptoms. And not only the internal medicines, the Murti Tailas like Shiro Taila, Shiro Abhyanga, Shiro Piju, and Shiro Dhara, especially with Kshira Bala and some Tailas also helps in managing such conditions. Again, there is no research regarding this available in the literature. And coming on to next, the endometrial changes. And this is yet another complaint which the patient present in the OPD, that is they will be having an irregular menstruation. And if they are nearing to the menopause, or if they are somewhere near 45 year or 50 year, we will always predict it may be due to perimenopause, or it may be due to the menopause. But before that, we have to find out the cause of, we have to rule out all the other causes of the abnormal uterine bleeding. As per the FIGO classification, the palm coin criteria have to be followed. Here, the structural causes has to be ruled out, like polyp, adenomyosis, leiomyoma. All these can be found out through the investigations like ultrasonography or histopathological examination. So all these has to be ruled out before coming on to the conclusion that it is just a physiological perimenopausal bleeding. In the physiological perimenopause, even if it is a physiological perimenopausal bleeding, we have to look into various factors. In a study, it was found that a patient presenting with the abnormal bleeding, abnormal uterine bleeding, the histopathological findings of these patients, that is perimenopausal patients, as well as the postmenopausal patients with abnormal uterine bleeding, the histopathological findings of these two groups were compared. And it was found that among them, like in the perimenopausal women, majority of the histopathological findings was pointing towards the proliferative endometrium, which is quite normal. And to a major, like 21 patients showed endometrial hyperplasia, wherein postmenopausal patients, the menopausal bleeding or the histopathological finding was due to atrophic endometrium and like endometrial carcinoma. Among 3 patients had endometrial carcinoma. So what is these terms actually? So while coming on to the perimenopausal bleeding, we have to send the patient for radiological investigation, transvaginal ultrasonography. The findings will mostly endometrial hyperplasia. So endometrial hyperplasia means if the thickness of the endometrium is more than 12 mm, and if it is more than 12 mm, definitely we will have to move on to further histopathological like biopsy, like or DNC, wherein they will analyze whether this hyperplasia is a simple one or complex one, or whether it is associated with atypia or without atypia. So if it is associated with atypia and if it is a complex type, which indicates that the patient may have a chance of malignancy in the future. So all these tests will help us to support the patients and will help to decide proper treatment. So in case of a pre-malignant condition and malignancy, we have to refer the patient. Definitely, we have to refer the patient. And we should not just prolong the patient with all our management. And similarly, in case of the postmenopausal bleeding also, all these workouts has to be done. In postmenopausal women, if we are going for a transvaginal ultrasonography, if the endometrial thickness is less than 4 mm, the bleeding can be from the atrophic endometrium. That is fragile endometrium. The bleeding can be due to the shedding of that endometrium. But if the endometrial thickness is more than 4 mm, definitely we have to send the patient for further investigations where biopsy has to be taken and the malignancy has to be ruled out. So these are all the diagnostic workouts which we have to do in case of a perimenopausal bleeding. We should not neglect the irregularities of the menstruation which is seen in the perimenopausal just as a normal one. We have to rule out all the abnormal pathologies or the abnormal complications that can be arise out of that. And all these perimenopausal bleeding or the abnormal uterine bleeding, which we see in the menopause, can be classified under the broad umbrella that is asrugdara. Adiprasangena pravrutam anurdavavi asrugdaram vijaniya tado anyat rakta lakshana. And the immediate rectus stambhana chikitsa can be adopted like Raktadisara chikitsa, Rektapitta Chikitsa, Rektarsha Chikitsa can be imbibed into the Asriddhara Chikitsa. And here also we have to, one more another important point is that we have to check the hemoglobin level of the patients. HB, if it is very low, if it is below 7 or if it is below 8, we have to first, we have to try to do the blood transfusion or the measures we have to take for correction of the anemia. And then we can go for the Asriddhara line of management. Initially, we have to do the rectastambana, and after that, we can go for the correction of the pathology or to correct the dysfunction to some extent. To some extent, it is reversible. And various medicines like Tengin Pukuladi Rasayana here in Kerala, we use it extensively during perimenopausal period, which gives us better result. And even Tiktagagrida, Mahatiktagagrida, Yoni Vasti, Uttara Vasti, and all the Shodhana procedures also helps in controlling this particular condition. Next, changes at the level of weight gain and fat distribution. Usually the patient comes, who are coming with the perimenopausal symptoms also complains that they are having weight gain during this time. So no need to worry. We have to assure that up to 4 kilogram weight gain is considered as a normal during the menopause. Actually, this is a complementary mechanism adopted by our body because this fat helps to produce a little level of estrogen. And hence, this is a mechanism which is normally adopted by our body to complement the reduction of estrogen in the body during the menopause. And but another negative side of this fat redistribution is that normally the female phenotype is changed to more android phenotype. That is, the body fat will be more collected on towards the pelvic area, and the consequence of this is that the patient will have more metabolic disorders, or the risk of metabolic disorders increase with the menopause due to the fat collection in the belly. So here, risk is actually with the increasing age, normally the metabolic activity decreases and the caloric requirement also increases. At this point, with an increasing weight gain, normally there will be a weight gain, and with the abdominal fat deposition, there increase the risk of insulin resistance. And along with this, the estrogen also is declining, which in turn will what promotes the risk of insulin resistance. Finally, the patient moves on to the increased risk of diabetes mellitus and dyslipidemia. This is very beautifully explained in our classes. Actually, this is actually noted usually under Prameha Chigilsa. Susruta Samhita, when explaining the Prameha Nidana, explains that Trinam Pramehana Bhavanti. Normally, Prameha is not found in women. And he explains the reason also. Like Rajaha is being Rajaprasega Narina Masi Vishuddhyadi. Because in every month, the female is getting the menstrual cycle, which in turn does the Vishuddhada or Shodhana of the body. And all these regular menstruation, which happens regularly in every cycle, act as a shield protecting the women from all these metabolic disorders. So this is explained by Acharya Susruta. And by the menopause, what happens is by losing these regular menstrual cycle or losing these normal hormonal activity, the woman is exposed towards all these metabolic disorders or the risk of diabetes and dyslipidemia. So next is the changes at the lower reproductive tract. So coming on to the lower reproductive tract changes, the studies have found that steroid receptors, that is estrogen receptors, have been found in the mucous membrane of urethra, bladder, and vagina. And hence, while moving on to the menopause, the symptoms of these organs will be, or these parts will be pronounced. Like the patients will be experiencing dyspareunia, vaginal infections will be more, vaginal dryness will be there, and pruritus will be there, leukorrhea will be there. And similarly, the urinary complaints like increased urinary frequency or urgency will be experienced by the patient. And she may be having a dysuria or the urge incontinence will be there. So altogether, nowadays, it is being coined as both vaginal and the urinary symptoms is collectively now denoted as genitourinary syndrome of menopause, that is GSM. So this genitourinary syndrome of menopause in a late sequel can result in urogenital atrophy, and finally it can result into pelvic organ prolapse. Here also, Ayurveda classic experience, various procedures, Thanika Chikitsa like Yoni, Praleba, Basti, Abhyanga, Parishega, Praleba, Pijudharana. Basti, Abhyanga, Parishega, Praleba, Pijudharanam has to be done after the Shodhana. Sarvadaha Suvishuddhaya, Shesham Karma Vidyade. So in Samanya Yoni Vyabhat, it is being told as if a patient is having any abnormality or in any Yoni Vyabhat, she can be she can undergo Mrita Shodhana, and after that it can be followed by any of these Thanika Chikitsa. And here also the Yoni Prakshalana, Kashaya, the selection of the Kashaya Drivya can be based on the Dosha Vikalpada, and Yoni Piju, Yoni Abhyanga, Yoni Vasti, all these things to somewhat restore the normal functions of these uh, urogenital system and to improve these symptoms. And like many research studies have been focused on this area. Even one of the research was carried out in our department, wherein we assessed the effect of the Yoni Piju and Yoni Abhyanga with Tilataila in patients who are having pelvic organ prolapse, pelvic floor prolapse. So what we have to do is that nowadays there are many objective criteria and many instruments by which we can assess the pelvic floor strength. So if more researchers are focused, or if more researchers are coming with all these objective criteria or the instruments, we can document the result of our treatment more accurately and more precisely, wherein it will be again beneficial for the society, and also it can be translated among the scientific community. So a digital instrument called a pereniometer was used for assessing the pelvic floor strength, and the study was conducted among the patients who are having pelvic pelvic floor prolapse, by comparing these two treatments. So that the results will be published in the paper in the near future. We are hoping so. And finally, I would like to conclude by saying that all the problems, whatever we have discussed, all the menopausal symptoms, even the fat distribution changes, or the like increased metabolic risk, or it can be due to it can be vasomotor symptoms, it can be endometrial, whatever it is. A beautiful like remedy have been given by our acharya, that is Gridakshiradi Nityasu Mudidasu Kabatmasu Artavam Tishtadi Chidam Viparidastu Adhavanyada. Like Ashtanga Sangraha explains that those who are regularly having a habit of taking milk and ghee, and those who are always in a mudita avastha, that is, those who are always happy, or those who are harshapara, and those who are having shleshma prakriti, will have their artava for bahukala. That is, their artava is not going to deplete. So whatever these symptoms can be reduced to an extent by usage of all these Gridakshira, which is considered again as the Nitya Rasayana, and all these can be adopted, and many more references are there, and many more explanations are there in our Ayurveda Samhita. But due to the time like I think it is not World Menopause day has to be celebrated for a month, because in every day we can like explore in each and every symptoms and find out more references from our classical Samhitas and plan more researches onto that. So within the like with this, I would like to conclude my presentation, and thank you once again for the organizers. Thank you, sir.
Thank you very much, Dr. Anjali. Thank you very much.
Thank you.
Very fast, super fast presentation with full of knowledge, Great.
Thought of completing it in the time, sir. That's right.
Thank you, Ramdas ji. Dr. Ramadasa, please. Am I audible to you? No. So thank you. Without wasting much time.
Yeah. Okay.
Thank you very much. I would like to request Dr. Anagha Sivanandan. It is very surprising that we are doing a mistake again and again. We are sorry for it. She's PhD scholar there in ITRA, but they are by our designing that is being indicated that she will be appointed as assistant professor in ITRA very soon. These are our blessings. God bless you, Anagha. All the best. Dr. Anagha from Jamnagar. Welcome, welcome.
Sir, I think my slides are visible.
Yes, yes, clear. Wow, great topic.
Namaste everyone, and pranams to all my gurus and all seniors over here. I'm very thankful to the organization for giving me a wonderful platform to share my views on the occasion of World Menopause Day. And thank you so much, sir. And we have already heard, we have listened to a very informative talks by Dr. Deepa Madam and Dr. Anjaly Ma'am now about the concepts of menopause and the different symptoms as part of this menopausal transition, and the Ayurvedic concepts of menopause and the Ayurvedic management or Ayurvedic care in the form of ahara, vihara, and aushadha. Everything we have already listened from a very expert speakers, Dr. Deepa ma'am and Dr. Anjaly ma'am. So I'm here just to share some of my views and some of my experience on the role of music in the Ayurvedic management of menopausal syndrome. As a student of music, I was very interested in to work with this topic. And as part of my PhD work, I had an opportunity to evaluate the effect of music as a therapeutic intervention along with Ayurvedic Rasayana therapy in patients of menopausal syndrome. So I would like to share some of my experiences also. So in theme of World Menopause Day 2022, that is cognition and mood. So I feel it very interesting because it remembers us the very phrase from the famous quote defining a healthy person by Acharya Sushruta. So samadosha samadnishcha samadhatu malakriya. Apart from that phrase, the equally important thing, prasanna atmi indriya mana, that everybody knows, and it is very relevant in the present era also. I think it is very much suitable in this context also while dealing with this menopausal syndrome. So the theme of World Menopause Day 2020, that is cognition and mood, and this very unique concept of Ayurveda on health that go in hand in hand. So as we already discussed, menopause is a biopsychosocial phenomenon. Already we have discussed with the Ayurvedic concept and all. I will just go very fast with all those things. It's a natural stage of aging, and Ayurveda also agrees with that. And the very famous quote by Acharya Sushruta, Jara Pakva Shariranam Yati Panchashadakshe. In while describing the menstrual physiology, Acharya explains the menopause as a part of Jara in females. And this Jara is coming under the classification of Swabhavika Vyati, that is natural phenomenon. So for that, there is the Chikitsa is Sadharana Kriya, that is Sadharana Chikitsa means the preventive or prophylactic care to maintain the general health and well-being. So that is the treatment option given by Ayurveda. So the menopause is, as we told, it's a transition from the reproductive to non-reproductive life, that is fertile to infertile. So in general, in a menopausal women, the status of dosha, we can say, like there is increased state of vata and altered functions of pitta and decreased state of kapha. As we have already discussed, Deepa madam has already discussed everything. So in this, in the maintaining the normalcy of the HPO axis, that is hypothalamus, pituitary, and ovarian axis, Vata dosha is having a very crucial role. Vata in its different forms, like pranavayu and udanavayu at the level of hypothalamus and pituitary level, and samanavayu at the level of ovaries, and dhyana and apana, especially in uterus and all. So Vata dosha in its different form has a crucial role in maintaining the physiology of this HPO axis. And all these endocrinal secretions, the hormones, what we call, which are released into the blood or to the circulatory system, we can consider them as a type of Agnis, different type of Agnis in different levels. So that Agni means nothing but the Pitta dosha itself. And as a whole, in a menopausal women, the condition, so there is a decreased state of kapha. So that is the status of doshas in menopausal women. And so the symptoms due to this menopausal transition also, we can say, like the vasomotor symptoms like hot flashes, night sweats, etc. Then the psychological symptoms like mood swings, irritability, nervousness, anxiousness, depression, etc. In all these symptoms, we can assume an altered function of mainly the Vata and Pitta dosha. And if we go to the status of dhatus, we have already explained there is gradual depletion or the kshaya of all the dhatus, starting from rasa, rakta, mamsa, meda, and asti up to shukra dhatu. In a natural menopause, as part of jara, the anna rasa become means unable to nourish the dhatu. Sa eva anna raso vruddhanam jara pakva shariratvat aprinano bhavati. So in natural phase, natural menopause, the kshaya happens from the ahar, means rasa dhatu to shukra dhatu, and rasa to rakta transformation, then the formation of artava, then artava also get depleted, and artava is also given the status of dhatu as per Acharya Bhava Mishra, and in female that artava should given a status of dhatu itself. And if we consider the changes in a female body after menopause, so in modern view, we will say all the symptoms are due to the lack of hormone estrogen in the body. So the all those symptoms we can attribute the functions of Shukra Dhatu, Harsha Bala Garbhodpadanahi Shukra. So here the Harsha means the psychological part, or the state of pleasantness, the state of peaceful emotion, happy emotions. All those things get depleted, and the Bala means the physical strength, that also get depleted, and also the fertility, that is the Purpadana that also get depleted. So all these symptoms we can attribute to the mainly due to the Shukra Dhatu Kshaya. So we can also say in case of artificial menopause, that means surgical menopause, if we are removing the ovaries, or we are removing in hysterectomy, we are removing uterus, and as part of that ovary also removed, then there is a sudden decrease of these hormones. So the effect of these hormones as the functions of Shukra Dhatu get diminished all on a sudden. So there a kind of Pratiloma Kshaya also happens, that affecting the preceding dhatus like Majja, Mamsa, Meda Mamsa, like that. So we can all over in a postmenopausal women, we can say all the dhatus are in a state of Kshaya, and due to the increase of Vata dosha, Vata vriddhi and dhatu Kshaya avastha. So along with that, there is alteration in the Manasa doshas also. They are also getting they are also getting disturbed in the Dushti of Manovahasvatas also happens. So in such a condition, the very important or the treatment of choice that a physician is having, that is Rasayana therapy itself. And also in this context, Vachikarana, the yogas in Vachikarana also we can incorporate in this context. So Rasayana therapy is the gold standard for this managing this menopausal syndrome. And in case of Panchakarma therapies, I have seen gone through the research works, and the Vasti therapy, Yapana Vastis, Rasayana Vastis, such kind of bastis are giving very good results. And also the Nasya procedure. Nasya procedure also very effective, as well as the Shirodhara. So there are an ample of research works done in different institutes of Ayurveda. And along with this, the practice of yoga and pranayama also is very beneficial, and research works are also being done on this yoga and pranayama also. But my topic of interest is on music, so I would like to concentrate on music here. So music, we know from the age of Vedas, in ancient Indian culture, we have a tradition of mantra therapy and all the different kinds of raga therapies, and all the classical textbooks of musicology are also gives different references regarding the use of music for curing diseases and all. In Ayurvedic classics, mainly the music is mentioned as an upakrama of Pitta dosha. And as part of Ritucharya, like Grishma Ritucharya or Sharad Ritucharya also, there are references regarding the use of music. And Acharya Charaka has mentioned it as a very general requirement in a hospital in the chapter Upakalpaniya. And the use of music for the management of different clinical conditions like Vijvara, Pitta Madatya, Rajeshma. Also, we have an ample of references. So, in the context of Shosha, that is Dhatu Kshaya Avastha, Gita Vaditra Shabdaischa, Priyashrutiti Revacha. So, that in that portion, the importance of music has been mentioned by Acharya Charaka. So, and as we all know, in case of Manasa Bhava, a very famous quote everybody knows, like Manasanam tu Shabdadi Rishto Varga Sukhavana. So that is also a reference which indicate the importance of music. And in Vajikarana, in Rasayana Kalpa also, for preparing the Rasayana Kalpa, and in the context of Vajikarana also, Geetam Stotra Manohari, it is mentioned. So keeping all this in mind, I thought to work on music, incorporating the Indian classical music along with Ayurvedic treatment protocol. Well, when I go through the previous research works, when I had a literature review, there are a lot of works on music therapy in women's health, but especially in menopausal symptoms also there are works from the very early age, like 1989, maybe before 30 years. Also, the effect of low frequency sound on menopausal symptoms, and a very recent one, which was published in May 2022. That is the effect of music therapy on menopausal symptoms and depression as an honest control trial. So keeping all these in mind, I started working on the topic. The topic of my PhD work was management of Rajonivriti Lakshana, that is menopausal syndrome, by Shatavaryadik Shirapaga with and without music intervention, an open label randomized comparative clinical trial. So there were two groups in my research work. In first group, that is group A, we have given Rasayana therapy along with music intervention. Rasayana therapy in the form of Shatavaryadik Shirapaga, which contains 3 drugs, that is Shatavari, Atibala, and Arjuna. So in a dose of 120 ml, means all these drugs 5 grams each, that is total 15 gram, made into Shirapaga form, that is 120 ml Shirapaga morning and evening for a duration of 1 month. And along with that, in group A, I have given music as a therapeutic intervention. And in group B, only the Rasayana therapy in the form of Shatavaryadik Shirapaga was given. So in total, means in each group, total 50 patients completed the treatment. And for that, for the purpose of preparation of music, we have adopted the principles from the textbooks of musicology Indian classical music, and also incorporating the principles from the Ayurvedic textbooks. We have prepared a melody for that, and we were planning to give in the active form of music therapy, but due to that COVID pandemic, we were not able to do it. So we have recorded it, and that pre-recorded music file was given to the patient with the proper instructions for listening to it, and for regular feedback through the telephonic conversations, or that WhatsApp groups like that. I have done the regular follow of the patients, and surprisingly, I got very nice response from the patients, and also very good results in the first group, that is Rasayana therapy plus music intervention also. So preparation of that music was done here only, and we have recorded it. The duration of that melody was 20 minutes. We have done it on the basis of Indian classical music. We have selected a raga madhyamavati for that, and we made a melody which was as simple as possible, which is very palatable to all everyone, without any complicated notes, any such complicated sundries, and all. Very simple one we have prepared, and we got very nice response feedback from the patients also. First of all, we have done a pilot study to test the palatability of that music. So in that we got positive response, so that we could use it for the further clinical study also. And we have used the flute, veena, then both female and male voice in the form of hummings only, not lyrics. No lyrics are there. And we used tabla for the rhythm, and a metallic instrument also for the rhythm. So so combining all these instruments and vocals, we have made that music, and we have given the pre-recorded music file to the patients, and we have made them convinced for 1 month of listening it with regular follow-up, and their feedback also was taken and recorded. So, and the assessment of the results were based on the scoring patterns on the dosha predominant symptoms, dhatu kshaya lakshanas, and manasika bhava in Ayurvedic context. Apart from that, the menopause specific quality of life questionnaire was given to the patient before treatment, after treatment, and during follow-up also. Then the levels of anxiety and levels of depression were assessed based on the Hamilton Anxiety Rating Scale, Hamilton Depression Rating Scale, and all. So in both the group, we got good result in all these parameters. And while comparing the difference in scores between the group, we got very better result in group A, where the music intervention was given. So coming to that conclusion, the music as a non-pharmacological intervention is having a great scope in the management of menopausal syndrome. And in the present clinical study also recommend the incorporation of Indian classical music as a therapeutic intervention along with Ayurvedic Rasayana therapy for better outcomes in the management of menopausal syndrome. The results of the study will be published soon. It's yet to be published. So on this World Menopause Day, that is October 18th, actually what I have to convey is that the viewpoint of the people or the society regarding this phenomenon menopause, it is different actually in as per the Western culture as well as in Indian scenario. In Western culture, they are more aware and more even the women are seeking the support by themselves, and they are forming peer groups, and there are various societies, various organizations for promoting their health. Like I have already shown that Menopause, the musical, they have organized very means there are worldwide organizing various shows and all. So if we come into Indian scenario, we don't have that much exposure or that much. We are a little bit backward in that case, and even our patients are not ready, or they are not expressive regarding their problems. If we ask them, did you, means as part of this clinical study, what I feel, did you have these symptoms? If you, whether you are feeling like this, then they will tell, yes, I'm having that. But means not in every cases. There are patients who come by themselves and say that I'm having these issues, and I think it is because of this menopause. I need a help, like that. So the scenario is getting changed now, but still, as compared to the Western people, we are a little bit backward, I think. So we should raise the awareness regarding this menopause in the society. Being a doctor or being a health professional, it's our duty, and we should also give them the support options. There are a lot of options for improving their health and well-being. So we should guide them, and we should promote that also. So that is my humble request to everyone, like during this occasion of World Menopause Day today. So let me conclude here, and I'm once again thanking you all for being with me, for the patient listening.
Thank
so
you.
much.
Thank you very much. Thank you, Anagha. Thank you. Very nicely explained in brief also. And Gagar mein Sagar. Wow. Gagar mein Sagar you have included. Thank you.
sir.
Thank
Thank
you.
you so much.
Now I would like to request Professor Parul ji. Parul ji Joshi is principal, Sri Bala Hanuman Ayurved College, Gujarat. Welcome, welcome, madam.
Good evening, everybody.
Good
It's
evening,
more
madam.
of night than evening.
Hari Om.
Yes. I'm sharing my screen.
Yes, ma'am.
Menopause, I think बहुत अंग्रेजी सुन लिया तो थोड़ा हिंदी में हो जाए. तो ये जो सिंबल है वो मेनोपॉज के लिए रखा गया है, और उसमें ये लोग बताना चाहते हैं कि यहाँ थम जाता है, फेमिनिनिटी थम जाती है. इट्स ए टाइम ऑफ चेंज. और अगर हैप्पी रहना है, सुचारू रूप से अगर हमें रहना है, तो हमें कुछ नियमों का पालन करना पड़ेगा. तो कौन से नियम हम पालन कर सकते हैं? तो ये जो व्याख्या बताई गई है, नेचुरल डिक्लाइन इन रिप्रोडक्टिव हार्मोन्स व्हेन वीमेन रीच हर 40s और 50s. लेकिन आयुर्वेद में बताया गया है याति 50 क्षयम. क्षय बताया है, नाश नहीं बताया. तो यहाँ से उसका डिप्लीशन शुरू होगा. डिप्लीशन तो स्टॉप नहीं बताया. तो यहाँ पे हम डिफर होते हैं. दूसरी बात जो बताई है वो मेनोपॉज इज सिंगल्ड बाय 12 months सिंस लास्ट मेंस्ट्रुएशन. अगला जो मासिक आया उसके बाद 12 महीने तक मासिक अगर नहीं आता है तो हम कह सकते हैं कि द वुमेन इज इन मेनोपॉज. लेकिन हमारे यहाँ पे मेनोपॉजल सिम्टम्स 75-80 इयर्स की वुमेन में भी नहीं मिलते हैं. और उसके लिए क्या देखा गया, ये जो कॉमन सिम्टम्स बताए गए हैं, हॉट फ्लशेस, वेजाइनल ड्राइनेस, ये सब मिलता ही नहीं है. तो ऐसा क्यों हुआ? तो उसके लिए हम अपने भारतीय जीवन पद्धति को देखें तो उसमें न्यूट्रिशन जो है वो अच्छा माता के पेट में आता है तब से शुरू करके माता ध्यान रखती है कि बच्चा को पूरा पोषण मिलता रहे और सतत मिलता रहे। तो ये जो हमारी संस्कृति है वो वहां से शुरू करके फिर वो जब बड़ी होती है तो उसका बॉडी, माइंड और उसका बिहेवियर सिर्फ माँ नहीं, सिर्फ पिता नहीं, सिर्फ परिवार नहीं, हर कोई गांव में जो है उसके ऊपर बच्ची पर ध्यान रखता था इसलिए बोलना पड़ रहा है कि आज उसमें सांस्कृतिक भेद आए हैं और उस सांस्कृतिक भेद की वजह से अगर कोई व्यक्ति किसी बच्ची में ज्यादा इंटरेस्ट दिखाता है तो उसको नेगेटिवली लिया जाता है। इसलिए काफी लोगों ने बोलना बंद कर दिया और दैट इज डिस्टर्बिंग। ऐसा नहीं होना चाहिए लेकिन हो रहा है। फिर केयर ड्यूरिंग डिफरेंट फेजेस बाय द वैद्य हिमसेल्फ। तो वैद्य क्या केयर ले सकते हैं कि आयुर्वेद के अंदर बताया है कि स्त्री रोग में हमें पुरुषेभ्यो दिक्कतजानीये नारीणाम आशयस्त्रय गर्भाशय दौ स्तन्याशय। तो उसके ऊपर कंसंट्रेशन करें तो जब वो रजस्वला होती है, ऋतुमती होती है, उसकी मैथुन परिचर्या में क्या ध्यान रखना चाहिए, सगर्भावस्था में क्या ध्यान रखना चाहिए और खास करके जो हम नहीं करते हैं वो है प्रसूतावस्था के दौरान क्या करना चाहिए। मैंने कई बार बोला है कि जो कल्लू करने की प्रथा है वो बहुत ही परेशान करने वाली है और स्त्री के प्रजनन अंगों में एक क्षोभ उत्पन्न करती है और उसकी वजह से प्रिकेरियस मेनोपॉज या अर्ली मेनोपॉज देखने को मिलता है। सूतिका कालीन परिचर्या का पालन न करने से स्त्री जो है बांझ हो जाती है। सूतिका व्यापत तो होते हैं लेकिन वो बांझ भी हो जाती है। बांझ का मतलब क्या है, उसका ओव्यूलेशन भी ढंग से नहीं होता है और उसका जो मासिक चक्र जो है वो भी डिस्टर्ब हो जाता है। कई बार देखा गया है बच्चे के जन्म के बाद माँ कभी मेंस्ट्रुएट नहीं करती है और गर्भ भी धारण नहीं करती है, फिर हम उसको काकवंद्या करके छोड़ देते हैं। उत्तरवस्ती कितनी भी देंगे इसमें रिजल्ट नहीं मिलेगा और वो काश्यप वचन है। धात्री परिचर्या जो है उसके अंदर देखा गया है कि धात्री काल में जब वो खास करके प्राइमी जो है पहली बार जिसको बच्चा हुआ है उस स्त्री के अंदर अगर ध्यान न रखा गया तो ज्यादा हर्षित भी हो जाती है और कभी डिप्रेशन में भी चली जाती है। ज्यादा हर्षित हो जाएगी तो बच्चे के लिए वो अधीर हो जाएगी और डिप्रेशन में चली जाएगी, बच्चे को अपने से दूर रखेगी। दोनों परिस्थिति में उसका जो साइक है, मन जो है वो डगमगा जाता है और डगमगा जाएगा तो काफी सारी परेशानियां खड़ी कर लेगा। इसलिए ये सभी अवस्थाओं में दिनचर्या, निशाचर्या, ऋतुचर्या के उपरांत वैद्य को ध्यान रखना है और वो अगर ध्यान नहीं रखा तो फिर मेनोपॉज के बारे में हम बात करें तो सही बात है। फिर जो बात आती है कि जरा पक्व शरीराम याति 50 क्षयम। तो जरा पक्व, जरा अवस्था ही न आए इसी के लिए रसायन थेरापी बताई गई है। रसायन थेरापी में वय बताया है, पूर्व वय यानी कि मिनार की और मध्य वय यानी कि जब वो अपना फैमिली कंप्लीट कर लेती है यानी कि 35 to 48, 40 इयर्स का जो एज ग्रुप है 5 इयर्स 35 to 40 उसके अंदर वो अगर रसायन का सेवन सम्यक रीत्या यानी शोधन पूर्वक करती है तो अभी यहाँ पे जो शोधन पूर्वक करती है, मन का नियंत्रण पूर्वक करती है, ये सब बातें जो है इसमें ये ध्यान रखना जरूरी है बचपन में उसको कोई ऐसा क्षय उत्पन्न करने वाला डिप्लीटिंग डिसऑर्डर न हुआ हो। हमको पता है उसको सालों तक रोमेटॉइड आर्थराइटिस रहा है और हम उसको विरेचन करवाते हैं, वो फिर से जाएगी। तो ये सब ध्यान रख के करना जरूरी है। तो अगर 35 to 40 के एज ग्रुप में हमने उसको रसायन दिया तो उसको जरा आएगी नहीं और जरा आएगी नहीं तो फिर मेनोपॉज का प्रॉब्लम रहेगा ही नहीं। ये हमने देखा है और मेरा एक रिसर्च पेपर था जो फर्स्ट एशिया पैसिफिक कॉन्फ्रेंस सूरत में हुई थी उसके अंदर मैंने पेपर प्रेजेंट किया था। उसमें हम लोगों ने ब्राह्मी, जटामांसी, वच्चा और शंख पुष्पी इसका कॉम्बिनेशन दिया था। और एक ग्रुप में जो है सिर्फ ड्रग्स दी थी, दूसरे ग्रुप में हम लोगों ने जो है उसमें प्राणायाम दिया था। तो प्राणायाम वाला जो ग्रुप था उसमें हमें ज्यादा रिजल्ट मिला, क्योंकि नहीं वाता द्रुते योनि नारीणाम संप्रदुष्यति। तो ये योनि क्या व्यापद तो नहीं है, लेकिन आर्तो से रिलेटेड व्यापद है, इसलिए हम उसको मेंस्ट्रुअल डिसऑर्डर के अंदर लेंगे तो वहां पे वायु का कर्मकत्व, खास करके अपान वायु और व्यान वायु सब प्राण के साथ मिलकर अपना काम करते हैं, तो वो हमें रिजल्ट मिलेगा। अभी इसमें बताया है कि रिप्रोडक्टिव ईयर्स, पेरीमेनोपॉज, पोस्ट मेनोपॉज। तो पेरीमेनोपॉज का टाइम बताया, उसके पहले का टाइम जो है यानी कि रिप्रोडक्टिव ईयर्स, रेगुलर पीरियड्स, उसी को अगर हम संभाल ले तो पेरीमेनोपॉज और पोस्ट मेनोपॉज आए बिना सीधा ही स्त्री वृद्धा हो जाएगी, और प्रॉब्लम्स एट वर्क जो बताए गए हैं वो हमें देखने को नहीं मिलेंगे। तो ये मेनोपॉजल ट्रांजिशन है, ट्रांजिशन फ्रॉम एक्टिव रिप्रोडक्टिव फेज टू पैसिव फेज, जो हमें आश्रम अवस्था में भी बताया गया है कि सबसे पहला जो है वो तो बच्चा है, लेकिन जब किशोर बनता है तो ब्रह्मचर्याश्रम, फिर वो जब कमाने लगता है तो होता है गृहस्थ आश्रम, जब उसके बच्चे हो जाते हैं, फैमिली हो जाती है, तब बच्चे भी बड़े हो जाते हैं तो वानप्रस्थाश्रम, यानी इट इज प्रायर टू संन्यासाश्रम। अपने फैमिली को वो अच्छी तरह से सब कुछ सिखा देता है और फिर सब कुछ सौंप देता है और खुद संन्यास में चला जाता है, यानी निवृत्ति। तो निवृत्ति के टाइम में जब मनुष्य चला जाता है, स्त्री हो या पुरुष हो, मनुष्य की बात है यहाँ पे कुछ ज्यादा फर्क नहीं है स्त्री और पुरुष के बीच में। जब हम मेनोपॉजल ट्रांजिशन की बात करते हैं तो वह एंड्रोपोजल ट्रांजिशन हो रहा होता है, वो उसमें भी यही सब रूल्स लागू पड़ते हैं। तो ये वेट के लॉस ऑफ लिबिडो, मूड स्विंग्स, ये सब जो बातें हैं वो मेनोपॉज सिंड्रोम के साथ जुड़ी हुई है। और मैं तो मेनोपॉज आए ही नहीं, क्योंकि वो आयुर्वेद सम्मत बात ही नहीं है। इससे प्रॉब्लम क्रिएटेड और उस प्रॉब्लम से हमें बाहर निकलना है। तो ये रिसर्च स्टेटिस्टिक्स है कि 3 in 5 women experiencing menopause worry that their symptoms have had a negative impact on their work. Almost 50% require a day off. 1 in 4 women experiencing menopause don't get the support they need from their manager. This is the truth. इसीलिए मैंने ये स्लाइड रखी है और वो भी लाल में है। The administrative people don't understand that she is passing through this phase and she requires mental support. तो ये जो फैक्ट्स है इसके ऊपर काफी सारी चर्चा हो गई है। तो ये जो स्टेजेस में से स्त्री पसार हो रही है तो सिर्फ जेनेटर्स नहीं, उसका पूरा बॉडी जो है उसके अंदर तुमुल मचा है और वो पूरा उसका सिस्टम जो है वो कैओस्ड है। उसके बीच में उसको स्थिर रहना है, उसको फैमिली जो है वो, क्योंकि इस वक्त जो है वो गृहस्थ आश्रम छोड़ने की सोच रही है, नई नई बहू आई है या फिर जामाता आए हैं, बच्चे घर में छोटे छोटे हैं, उनको संभालने, इसके बीच में ये सब उसको झेलना है और उसमें स्वस्थ रहना है। तो टाइप्स ऑफ मेनोपॉज में स्पॉन्टेनियस, अर्ली एंड प्रीमेच्योर, प्रिकेरियस जो हम बोलते हैं, और इंड्यूस्ड मेनोपॉज। तो लाइफस्टाइल चेंजेस हेल्प मैनेज symptoms of post-menopause. Use water-based vaginal lubricants, regular relaxation exercises, meditation, eating diet. ये जो है इसमें मुझे थोड़ा ऐड करना है कि हम लोगों को देखा था कि सुगंधित पुष्प धारण करने से या उस अपने पास रखने से या अपने घर में रखने से उसमें वातावरण पूरा बदल जाता है और शी फील्स वेरी प्लेजेंट। फिर अलंकार धारण करवाते थे और मैं उनको बोलती थी, प्राय ये महिलाएं हैं जो सफेद कपड़े या काले कपड़े ऐसे कपड़े पहनना शुरू कर देती है, तो मैं उनको बोलती थी कि चीयरफुल रहो आप, क्योंकि अगर आप चीयरफुल रहेंगे तो आपको जो है ये नेगेटिव सोच आती है कि मैं मेनोपॉज में गई, अब मैं बूढ़ी हो गई, मेरा हस्बैंड छोड़ देगा, ये सब बातों से आप बाहर निकल जाएंगे। तो फिर मैं उनको ऐसे अलंकार पहनने को कहती थी जिसमें आवाज आए, जैसे कि हम पायल पहनते हैं, कमरबंद पहनते हैं, या फिर कीचेन जो है वो भी घुंघराली हो, फिर बालों में घुंघरू डाल दे, हाथों में कंगन यानी कांच की कंगन पहने। तो ये सब आवाज जो है वो जिस तरह मैडम ने बताया म्यूजिक थेरेपी, वो म्यूजिक थेरेपी के साथ एक्यूप्रेशर भी करते हैं। तो इनकी जो है वो बहुत पॉजिटिव इफेक्ट होती है। और कई महिलाएं तो आगे बढ़ के जिनको फैमिली सपोर्ट था, वे समय समय पे मंदिर जाके वहां पे घंटा बजाते थे, और घंटा बजाने की वजह से उनके जो विचार है उसमें काफी सारे फर्क आए, ऐसा उन लोगों ने महसूस किया। ये जो है वो बिना औषध दिए हमें जो रिजल्ट मिला उसकी बात है। अब ये पिट्यूटरी ग्लैंड है, पिट्यूटरी मास्टर ग्लैंड, उसी की सभी के ऊपर असर है। सो मेनोपॉज, एंड्रोपॉज, एड्रेनोपॉज या मेनोपॉज जो भी बोले आप, पिट्यूटरी ग्लैंड मास्टर ग्लैंड की असर होती है। तो हमारी दिनचर्या में नस्य लेना तय है, लेना ही चाहिए और हर रोज लेना चाहिए। अगर हम नियमित नस्य लेते हैं, शिरस तर्पण करते हैं, तो पिट्यूटरी ग्लैंड में कोई भी किसी भी तरह की कोई तकलीफ होगी नहीं। और ये जो पॉज है ना, वो कोई पॉज आएगा नहीं, गाड़ी एकदम स्पीड में चलेगी, बुलेट ट्रेन ही चलेगी और जिए तब तक चलेगी। तो ये मुझे कहना है। दूसरी बात यहाँ पे जो मुझे ऐड करनी है, विरेचनेन शुद्ध्यति नार्यः, नारी का शोधन, खास करके विरेचन बार बार देते रहना जरूरी है। अब सभी का फेवरेट ड्रग फलग्रुत है, और फलग्रुत का ड्रग्स जो है वो मंजिष्ठादि के साथ काफी मिलता जुलता है। तो ये जो ड्रग्स है मंजिष्ठादि और फलग्रुत, दोनों की असर स्किन पे होती है, और जो भी स्किन पे असर करेगा वो तापमान पर भी असर करेगा। तो ये ध्यान में रखना जरूरी है। फिर मैं जो है मेनोपॉजल सिंड्रोम डायग्नोस करवा के महिलाएं आती है, उनको मैं अकेला फलग्रुत नहीं देती हूँ, मैं उनको ब्राह्मीकृत भी देती हूँ और शतावरीकृत भी देती हूँ। उसमें मैंने कॉम्बिनेशन ऐसा बनाया है, 4 पार्ट्स फलग्रुत, 2 पार्ट्स शतावरीकृत एंड 1 पार्ट ब्राह्मीकृत। इस तरह हम देते हैं, और हर रोज सुबह 30 ग्राम उसको लेना है। 90 दिन, 3 मंथ्स, 90 डेज उसको कंटिन्यूस लेना है। फिर उसको 15 दिन कुछ नहीं लेना। उस दिन जो 15 दिन उसको घृत नहीं लेना, वो 15 दिन वो हर रोज सुबह में 8 से 8:30 के बीच में 2 टैबलेट एरन ब्रेस्ट हर डे ले लेगी। फिर से वो जो है वो इसको कोर्स चालू रखेगी, तब तक चालू रखेगी जब तक ये सिम्टम्स से बाहर नहीं आ जाती, और काफी आराम से महिलाएं चली जाती है। और ये कॉस्ट इफेक्टिव मेडिसिन है, उसको बॉडी भी अच्छा रहेगा, उसकी स्किन भी अच्छी रहेगी, उसके जॉइंट्स भी अच्छे रहेंगे, नो ऑस्टियोपोरोसिस और नो मूड स्विंग्स, नींद भी ढंग से आती है, और फैमिली का वातावरण जो है बना रहता है। कई बार महिलाएं आके पूछती थी मेरा हस्बैंड ले सकता है क्या, तो मैं बोलती थी हाँ, हस्बैंड को भी दो और घर में छोटा बच्चा है उसको भी दो। हाँ, फलग्रुत मैंने एतत् परम च बालानां ग्रहणम देहवर्धनम, इसलिए फलग्रुत में बच्चों में भी देती हूँ। अब इसमें ये स्लाइड में मैं दिखाना चाहती हूँ कि मेनोपॉज और एंड्रोपॉज के सिम्टम्स जो है वो काफी साम्यता रखते हैं, और हम नारीवादी हो के पुरुषों को अन्याय करें ये तो बिल्कुल नहीं चलेगा ना। तो प्राय सेम सिम्टम्स रहते हैं, बेचारे कुछ बोल नहीं सकते, तो उनको भी ध्यान देना चाहिए। यहाँ पे मैंने ब्लैक हाईलाइट किया है कि हेडेक्स है, वोलेटाइल इमोशंस है, नाइट स्वेट्स है, मसल्स थिनिंग है, वेट गेन है, ऑस्टियोपोरोसिस है, लो लिबिडो है। ये सब भी बातें जो है वो एंड्रोपोज में भी हमें दिखती है, तो इसके ऊपर भी ध्यान देना जरूरी है। अभी यहाँ पे हम देखें कि जो एड्रेनोपॉज है उसके अंदर भी उन्होंने बात हाइपोथैलेमस की, उसका जो एंटीरियर पिट्यूटरी, एसीटीएच, एड्रिनल कॉर्टेक्स, और ये जो हम यूरोजेनेटल सिस्टम जब हम बोलते हैं और एचपीओ एक्सिस जब हम बोलते हैं, तो उसमें ये सभी कुछ आ जाते हैं। यहाँ पे जो मैडम जी सभी तीनों ने बताया वही बात है, मेडिटेशन, एक्सरसाइज, रीच आउट फॉर सोशल सपोर्ट, सेट गोल्स फॉर हॉबीज। मन को अगर हम खुला रखेंगे तो वो तो ऐसा ही बोलेगा, भाई मैं तो बहुत परेशान हूँ, लेकिन उसको कहीं ना कहीं कोई टारगेट दे दे, उसको कोई गोल दे दे, तो वो जो है ये सब भी तकलीफों से बाहर उभर कर बहुत अच्छा परफॉर्मेंस कर सकता है। और मैं क्यों सोचूं कि मैं बुढ़िया हो चुकी हूँ, मैं अब भी वही हूँ, मुझे जो काम करना है मैं करूंगी, और मुझे जो गोल अचीव करना है मैं करूंगी, तो वाकई में ये सब प्रॉब्लम्स आते नहीं हैं। जो व्याधि हाइपोथैलेमस और पिट्यूटरी से रिलेटेड है, वे मनसीज होने की संभावना ज्यादा है। इसलिए मेरा ये मानना है कि मेनोपॉज का डेटा फायरिंग करने के बजाय हम उनको समझाए कि अभी आप जो है, ये आपका ग्रोथ हार्मोन जो है वो डिप्लीट होने शुरू हो गया है, इसकी वजह से आपके ऑर्गन्स जो है उनमें रीजनरेशन कैपेसिटी जो है वो कम होती जा रही है। इसलिए आप ये ध्यान रखें कि डिप्लीशन न हो, हर कोई ऑर्गन अच्छी तरह से काम करे, और वो तब ही हो सकता है जब आप हर एक ऑर्गन पे ध्यान दें। ये मैसेज होना चाहिए। आप मेनोपॉज में जा रही हैं इसलिए आपको ये सब होगा, इसके बजाय हम ये बात करें तो मैं समझती हूँ कुछ ज्यादा साइंटिफिक हो पाएंगे हम। ये बातें आप देखिए हर जगह पर ब्रेन फंक्शंस की ये बातें हैं, तो हम ब्रेन के जरिए महिला को अस्वास्थ्य नहीं स्वास्थ्य सुरक्षा की बातें कर सकते हैं, और उसका दिल और बॉडी, उसका मन, उसकी चेतना सभी को स्वस्थ रख सकते हैं। इसमें भी आप देखिए कि एनवायरनमेंट, जेनेटिक फैक्टर्स प्ले अ रोल in menopause, andropause, melatonin deficiency, etc., disturbing all types of hormones. लेकिन nutrition, lifestyle, exercise stop them. Hypothalamus, somatopause, इन सभी को वो stop करेंगे और the person remains healthy. ये उन्हीं का क्रिएटेड है जिन्होंने मेनोपॉज को इतना बड़ा चढ़ा के व्याधि बना के रखा है। ये गुजरात का है, हमारे अहमदाबाद जिला का जो डिस्ट्रिक्ट आयुर्वेद ऑफिसर होते हैं उन्होंने बनवाया है। इज अ वंडरफुल पर्सन। और ये मेनोपॉज क्या है उसके बारे में समझन, कैसे स्वस्थ रह सकते हैं, आपको क्या करना चाहिए क्या नहीं करना चाहिए, और अगर आपको कोई इंफॉर्मेशन चाहिए तो इन जगह पर आपको इंफॉर्मेशन और गाइडेंस भी मिलेगा, आपको दवाई भी मिलेगी, आपको एडमिट होना है तो एडमिट भी होंगे, और ये सब जो है वो किफायत की मुफ्त है। ये सब बातें पब्लिश्ड ब्रोशर में है। ये इसके ऊपर मैं हाईलाइट करना चाहूंगी। मेनोपॉज सिम्टम्स बी डैम्ड, women thrive post menopause. 96% women care about health. They care more about their health. They feel happier. They feel more confident. They have more disposable income. They feel more physically strong. Feel in control of their career. क्योंकि ये जो उम्र के वर्ष है उसमें सेटिस्फेक्शन आता है, प्रोवाइडेड उसने अपनी कैरियर फ्रॉम डे वन संभाली है। एकदम से कैरियर में बूस्ट आ गया तो मेनोपॉज उसके लिए दिक्कत खड़ी करेगा, लेकिन अगर उसके पास गोल है कि मुझे ये करना है तो शी विल डेफिनेटली थ्राइव। यूएस मेनोपॉज मार्केट साइज ये 2016 से 2028 उनका टारगेट है, उनको 28 में इससे भी आगे बढ़ना है, और यूएस डॉलर्स में ये वास्तविकता है। प्री मेनोपॉज, पेरी मेनोपॉज, अर्ली मेनोपॉज, लेट मेनोपॉज सभी में जो सिटी स्कैन बताए हैं उसमें आप देखिए कि ब्रेन फंक्शंस, ब्रेन का जो केमिस्ट्री है उसको हम देख के समझ सकते हैं कि अगर बचपन से ही उसको नस्य की, शिरस्तर्पण की, कर्णपुरण की, पाद अभ्यंग की, सर्वांग अभ्यंग और सर्वांग स्वेदन की अगर आदत होती है तो ये ब्रेन स्कैन में हमें डिफरेंसेस नहीं मिलेंगे। एक जो मेरा प्रयोग था जो मेरे पेशेंट्स को बहुत ही अच्छा लगा और वे लोग खुद भी करने लगे और अपने पड़ोसियों को, अपने रिश्तेदारों को भी बताने लगे, क्योंकि एकदम हार्मलेस है। चतुर्बीज चूर्णम, मेथी का, चंद्रशूरश्च, काला जाजी, ये वानी का, उसके अंदर हम लोगों ने गाजर के बीज डाल दिए, सब समान भाग, उतना ही गुड़ लिया, वो भी देसी गुड़, उतना ही घी लिया और उसकी सुखड़ी बना ली हम लोगों ने, पाक बना लिया उसका, और उसमें से 30 ग्राम सुबह, 30 ग्राम शाम भूखे पेट लेना है। और अगर उसको चाहिए तो थोड़ा गर्म पानी पी के मुंह साफ कर ले। आप मानेंगे नहीं, उनको ओबेसिटी की तकलीफ नहीं हुई, न आत्मान हुआ, न आटोप हुआ, न वात उद्गार बाहुल्य हुआ, न स्टूल की कोई प्रॉब्लम हुई, डायरिया या कॉन्स्टिपेशन, कुछ नहीं। और दे फेल्ट एनर्जेटिक, क्योंकि इसमें माइक्रोन्यूट्रिएंट्स भी है। तो ये जो है उसके ऊपर हम लोग कर सकते हैं, उसके मेंसेस भी रेगुलर हो जाते हैं। और अगर कहीं पे अगर उसने कॉपर टी यूज की हो युवानी में, या फिर उसने एबॉर्शन करवाया हो या नेचुरल एबॉर्शन हो गया हो, उन परिस्थितियों में यूट्राइन जो मसल्स है वो थोड़े थिक हो जाते हैं, तो वो एंडोमेट्रियल थिकनेस सब कुछ उसका नॉर्मल हो जाता है। चतुर्बीज के साथ गाजर बीज का पाक बना के खाने का, 30 ग्राम सुबह, 30 ग्राम शाम। दूसरा, जिन लोगों में आत्मन बहुत ज्यादा था और विचार वायु भी ज्यादा था, उनका ऑक्यूपेशन ऐसा था कि वे लोग नहीं सह पाए, एकदम आग बबूला हो जाते थे, कभी भी अपना दिमाग खो बैठते थे, उन महिलाओं में हम लोगों ने महानारायण तेल और क्षीर बाला तेल की मात्रा बस्ती शुरू की। क्योंकि उनको जॉब पे जाना रहता था तो हम लोग मात्रा बस्ती देते थे। हम लोग 10 दिन देते थे, फिर 20 दिन आराम, फिर 10 दिन देना, फिर 20 दिन आराम। इस तरह हम लोगों ने उनको आराम से मेनोपॉज यानी जरा अवस्था उनकी आराम से आ जाए, उसका प्रबंध हम कर पाए थे। In the end, the real wisdom of menopause may be in questioning how fun or even sane this core wheel called modern life actually is. Thank you. Thank you very much. Pawan sir? Sharma sir?
हाँ जी, हाँ जी, हाँ जी।
I finished.
Excellent, excellent, madam, excellent. Sorry, technical glitch के लिए कनेक्शन नहीं हो पा रहा था. Thank you very much, as always. Now I would like to welcome the concepts from the audience, if any. Now session is open. If anybody would like to add anything, I hope that will not be there because our experts have excellently summarized everything. Audience, please. Yes. डॉक्टर रंजन पटनगर साहेब, वेलकम।
हाँ, यस, जरा बाहर हूँ, इसके लिए वीडियो नहीं ऑन पर कर पा रहा हूँ, पर अभी पारुल मैडम ने तो सभी बातें बहुत ही अच्छी तरह कह दी है। तो उसमें एक ही पॉइंट ऐड करूंगा कि मैं मेरे प्रैक्टिस में काउंसलिंग, और वो काउंसलिंग भी हस्बैंड एंड वाइफ दोनों का करता हूँ, तो उससे भी फायदे बहुत अच्छे मिलते हैं। क्योंकि जैसा मैडम ने कहा कि वो फीमेल जो फेज से जा रही है वो सिर्फ उसका हस्बैंड ही अच्छी तरह से समझ सकता है, और उसको समझ करके उसी तरह से उसके साथ बर्ताव कर सकता है। तो इसके लिए मैं मेरे प्रैक्टिस में काउंसलिंग इसको भी ज्यादा इम्पोर्टेंट देता हूँ। मेडिसिन वगैरह ये सब बातें है ही, और जो ऑफिस गोइंग वुमेन्स है उनको भी अगर हो सके तो उनके जो फ्रेंड सर्कल है उनको भी काउंसलिंग करने की कोशिश करता हूँ। हर एक बार वो मुमकिन नहीं होता है, पर ये कोशिश मैं करता हूँ। और मेडिसिन के बारे में और क्या कहूँ, मैडम ने तो पूरा उसके बारे में विस्तृत जानकारी दे ही दिया है। सो थैंक यू वेरी मच।
Thank you, sir. Thank you very much. Thank you very much. Anybody else? If anybody would like to add anything. V.K. Agnihotri, sir. Respected V.K. Agnihotri, sir. Am I audible to you? So now time is more.
मोहन जी, आपका वॉइस ब्रेक हो रहा है।
जी टेक्निकल ग्लिच है।
अच्छा, ओके। हाँ।
अग्निहोत्री जी सुन पा रहे हैं? प्रोफेसर V.K. अग्निहोत्री सर। तो मैं आदरणीय राजन पटनकर जी से आग्रह करूंगा कि वो आज सेशन का समापन करें।
सॉरी टू से, क्योंकि उनके जितना तो मैं ये करने में एक्सपर्ट नहीं हूँ, पर फिर भी मैं पहले 2 लेक्चर्स नहीं सुन पाया, सिर्फ पारुल जी का ही सुना। पर ये सब्जेक्ट अवेयरनेस के लिए बहुत ही इम्पोर्टेंट है, क्योंकि आजकल जो सभी अलग अलग मार्केटिंग जो प्रोडक्ट्स है या जो भी चीजें है, उसके वजह से मेनोपॉज कभी कभी जल्दी भी दिखाई देता है, एट द एज ऑफ 35, 36, 40 तक भी। तो उसके लिए मेरे ख्याल से कुछ जो कारण है कि जैसे कि अपने इसमें अन्न वस्त्र, ये जो इम्पोर्टेंट बातें है, फूड हैबिट्स के बारे में तो जितना कहा जाए उतना वो कम है, पर वस्त्र के बारे में भी अगर कहा जाए तो मेरा ऐसा मानना रहता है कि आजकल की जो यंग जनरेशन है कि जो भी चीजें सब टाइट फिटिंग के जो पहनती है, उसका भी जो गलत असर है वो गर्भाशय के ऊपर जरूर होता है। तो ऐसे भी कोई पेशेंट्स देखे हैं कि जिनको आगे चल कर के बहुत सारे कॉम्प्लिकेशंस होते हैं, तो इसके लिए वो भी अवेयरनेस उतना ही इम्पोर्टेंट है। हर एक ये जब ये मेनोपॉजल वीक होता है वो समय में, या ब्रेस्ट फीडिंग वीक, उसके बारे में अवेयरनेस दिया जाता ही है, पर उसके लिए और भी कुछ ज्यादा कोशिश हम हमारे जैसे वैद्यों की तरफ से होनी चाहिए, यही मेरा मानना है। थैंक यू।
Thank you all. Now we will be meeting on 20th October for osteoporosis. On that day, World Osteoporosis Day is there. Thank you speakers. Thank you learned audience. Thank you very much. Good night.
थैंक यू। शुभ रात्रि। पारुल जी को तो बहुत बहुत बधाई, उनका प्रेजेंटेशन हर समय बहुत एकदम बेस्ट रहता है।
आज दिव्या जी, अनघा जी आज, और वो अंजलि जी और पारुल जी तो एज ऑलवेज, सभी का प्रेजेंटेशन बहुत अच्छा रहा सर, बहुत अच्छा।
नहीं, अभी फेसबुक पे देखता हूँ जरा बाद में। ओके,
थैंक यू गुड नाइट।
चलो।